Hi, I am Dr. Shasa Hu. I'm a board-certified dermatologist, associate professor of dermatology at University of Miami Miller School of Medicine. Today, I want to spend a few minutes talking to you about the causes, prevention, and treatment options of hand dermatitis, particularly in a hospital setting. A lot of our healthcare workers right now, especially those fighting the COVID-19 crisis on the front line, are experiencing hand dermatitis. So what is hand dermatitis? Intuitively, in the early stages, the signs of hand dermatitis may just be loss or ragged cuticles around our fingernails, dry hands with rough texture. But if not treated or addressed early, it can progress pretty rapidly into painful open skin fissures along the fingertips, really dry patches, sometimes even pink to red, scaly or oozy plaques along their palms, along their fingertips, and on the back of their hands. Hand dermatitis can severely affect a person's quality of life, especially if they're working in a hospital and clinic setting. And it has been estimated that 55% of healthcare workers develop hand dermatitis one time or another. But my guess is that that percentage is much higher during this pandemic crisis, as a lot of us are asked to practice very strict hand hygiene to keep our patients safe and keep ourselves safe. So first, let's talk about the causes of hand dermatitis. Hand dermatitis is actually a irritant hand dermatitis from overexposure of our hands to the combination of water, soaping agents such as sulfates, fragrances, and antiseptic chemicals found in hand soap or hand sanitizer, especially in the hospital setting. So this combination has shown to strip away the natural lipids in the top layer of our skin. It also breaks down our skin proteins or denatures the protein. And then additionally, that leads to a compromised skin barrier. Hand dermatitis is often a vicious cycle because as our skin protective barrier is compromised, our skin becomes more prone to the dehydrating and irritation effects of water, soaping agents, and antiseptic chemicals. The same holds true for alcohol-based hand sanitizer, but to a lesser degree. In a minority of people experiencing hand dermatitis, especially those with history of skin allergies, atopic dermatitis, asthma, or allergic rhinitis, known as the atopic triad, these people may experience an exaggerated form of hand dermatitis complicated by skin allergies. So here we often see allergies as an immune reaction to fragrances and preservatives that are commonly found in soaps and hand sanitizers. So how do we prevent and treat hand dermatitis in a hospital setting? Of course, ideally, we should recommend reducing the frequency of hand washing and avoidance of certain hand washing detergents or soaps or sanitizer containing fragrances and preservatives. But that's just not practical or possible in a lot of hospitals or clinics, especially during a pandemic crisis. So the compromise is to develop a good hand care routine, especially if you're a healthcare worker. What I recommend is to really pay attention, spend the time to hydrate your hands right after each hand washing or each hand sanitizer use. A lot of times it may be necessary to carry a pocket-sized hand moisturizer so that you can reapply throughout the day, if possible. And when you pick a hand moisturizer, Choose the ones that are fragrance-free over those perfumey, nice-smelling hand lotions. And choose ingredients that are known to hydrate the skin, such as hyaluronic acids, ceramides, squalene, and lipids. Also choose protective ingredients such as petrolatum, glycerin, and dimethicone. I want to share with you a few of my favorite hand cream and hand protectants. So just to give you some idea, of course, you can choose any fragrance-free hand cream containing the effective ingredients. So now let me show you. I like this Elta MD So Silky Hand Cream. It's actually more like a lotion consistency. It's very rich in ceramides and lipids to repair the skin barrier. Eucerin Sensitive Skin Eczema Relief with Colloidal Oatmeal is a little bit thicker. The oatmeal will actually help to combat redness, sometimes relieve itching for mild cases of hand dermatitis. This I recommend often because it's very easily found in any drugstore. It's a Neutrogena hand cream. It's fragrance-free. It's a little bit thicker. It's glycerin-based, as you can see here, but it still spreads very easily. And then lastly, I love this CeraVe healing ointment. The active ingredient is actually petrolatum, so it's a little bit heavier. It's more on the occlusive protective side. So here you can see you have a lotion-based, a cream-based, a glycerin-based, and an ointment-based. A lot of times it may be a little bit harder to spread the ointment-based hand cream, especially when you're in a rush. But keep in mind that when your skin is a little bit drier, you're already seeing cracks, you do need the more occlusive hand cream to get a faster response. It turns out that, especially for those healthcare workers who have to wear gloves, the occlusive nature of gloves on top of moisturizer has shown in studies to improve overall skin hydration. Another tip I like to share with you when you carry a pocket-sized moisturizer is that you keep the moisturizer in a designated pocket and you only grab it after hand washing and sanitize this tube frequently throughout the day to avoid cross-contamination. There are some additional ways to prevent and treat early hand dermatitis. One is actually to make sure your hands are completely dry after hand washing or the use of hand sanitizer before you wear your gloves, because it turns out that occlusive effects of gloves on water actually breaks down your skin barrier more so than just having dry hands. And then additionally, if possible, try to alternate between hand washing with soap and water with the use of hand sanitizer that is alcohol-based. In fact, studies have shown that alcohol-based hand sanitizers are a little bit less irritating on your skin while achieving the same purpose as a hand hygiene practice. And lastly, when you're not working, when you're just at home relaxing, try to be a little bit more diligent about moisturizing and hydrating your hands, especially at night or when you're going to take a rest. What I like to recommend, if you have the energy, is to double moisturize your hands, which is to combine a hydrating cream as a first layer, followed by a occlusive, more heavier ointment. You can even use plain Vaseline or Aquaphor, and that double layer of moisturization will allow your hands to heal a little bit faster and have the barrier reestablished a little bit quicker. But lastly, it's very important to reach out to your dermatology colleagues when you're having hand dermatitis that is not improving, or you're experiencing a lot of itching and burning with your hand dermatitis, because some cases do require prescription strength anti-inflammatories for us to get on top of the dermatitis. And then additionally, some hand dermatitis cases may be complicated by bacterial colonization. So it's important to treat and address hand dermatitis early. So that's all. Thank you for watching. Again, on behalf of everyone, we want to thank all the healthcare workers fighting the COVID-19 crisis on the front line. Thank you.